Tamam, şu an başlattım hocam.
Tamam, tamamdır. Ben şöyle önden Türkçe başlayıp sonra İngilizceye dönüp ardından da Gülcü hocama atacağım pası. Hocalarım, hepiniz zannediyorum beni duyabiliyorsunuz. Çok teşekkür ederim katıldığınız için. Şimdi İngilizce gerçekleşecek biliyorsunuz oturumumuz. O yüzden kısaca ben konuşup sonrasında da Gülcü hocama aktaracağım. Değerli katılımcılarımıza, değerli hocalarımıza çok teşekkür ediyorum. Aynı zamanda moderatör hocamız da yardımcı doçent, doktor öğretim üyesi yeni ismiyle Gülcü hocamıza da Çanakkale Üniversitesi'nden çok teşekkür ederim ve diğer katılan bütün hocalarıma. Söz sizde hocam.
Teşekkür ediyorum Merve Hocam. Tüm sunum yapacak katılımcılarımız sanıyorum Türkiye'deki üniversitelerden akademisyen hocalarımız. Ancak İngilizce gerçekleşeceği için sunumlar. Ben de hemen İngilizceye geçiyorum ve ayrıca da tekrardan tebrik ediyorum. Böyle başarılı bir organizasyonu gerçekleştirdiğiniz için bu vesileyle size. Good afternoon everyone. We meet for a COVID-19 session in the International Conference on Different Aspects of Health. First of all, I would like to thank to the organizing committee for this enriching organization. In this section, which I will be happily moderating, we have 4 presentations which concentrate on different aspects of this global issue, COVID-19. I suggest you to follow the schedule and stick on the program. Also, I would kindly ask you to respect 15 minutes limitation for each presentation, so we may have some time for the comments and questions at the end of the session. So first, we are going to start with a talk on psychological effects of COVID-19. I am going to give the floor to Ayşen Berberoğlu from Akdeniz Karpaz University, who is going to be the first contributor for this section. Ayşen Hocam. Acaba?
He may not be in the list at the moment, but we can start with the next speaker if you like.
Okay, that's fine. Maybe she's not here yet.
She might come, so yeah.
We can move with the second. Okay. I'm going to check. We can move to the second presentation, then we can. I'm going to give the floor to Zeynep Turhan then.
Yeah, I'm here. Thank you very much. And hello, everybody. And I'm gonna share my presentation. Sorry,
just click on the share screen, you know, at the bottom of the screen. Can you actually see it?
Okay.
Right.
There are lots of
yes,
skins, so I have just got it. Okay. Today, I'm going to talk about the actions, perspectives towards the COVID-19 candidate vaccine. So as you know, this is a very common talk about vaccination processes. I had my colleagues talk about how we can actually examine about the issues around this candidate vaccine. So we looked at the literature review and how we can understand these vaccine issues. Throughout my presentation, I'm going to talk about what's our research topic and then our overarching, research questions, and then our method, which was the literature review, and then our key findings and results. And then I'm going to talk about the very short conclusions and recommendations. Why coronavirus disease 2019 has deadly affected several people in the world, there are questions around COVID-19 candidate vaccine acceptance. It's important for us to actually explore what's the available evidence around the dynamics of the vaccine acceptance as well as the refusal. As you know, this can help us to reduce the individual's hesitancy about the future vaccines. Therefore, we looked at what the literature tells about individuals, how individuals actually accept and reject this candidate vaccine by focusing on their unique perception and circumstances. Here is our research questions. We have two main questions. First is about what is the available evidence about the perspectives about COVID-19 candidate vaccines among public as well as the healthcare workers. Second one is what are the actions and views of the COVID-19 candidate vaccine within individuals' unique conditions, which actually includes their demographic information as well as their, board, job, etc. Okay, throughout the literature review, we found many scholars actually found that people have been intent to refuse because they hold many concerns about the COVID-19 candidate vaccine. Potential reasons around that is that are potential side effects, inadequate knowledge about the vaccine, lack of trust in the vaccine procedures, and insufficient confidence around the effectiveness of safety of the vaccine. So these are actually people talk about their concerns around the vaccination process. We found 4 key factors around individuals' perspectives as well as actions towards the COVID-19 candidate vaccines. First is about the healthcare professionals' concerns and their knowledge about the candidate vaccine. Second is the high level of vaccine hesitancy among the public. Third is the roles of the public health authorities as well as the government. And fourth is again related to the third one, which was about the level of mistrust of the vaccination programs. This is actually based on the small or unpopular manufacturers. The first theme is healthcare workers' perspectives about vaccination. And the several studies looked at the elements around the individual's vaccine hesitancy by focusing on their views among either patients or healthcare providers during COVID-19. And what they told us, they found actually many healthcare workers talked about the influenza vaccine uptake was associated with working in public hospitals and all 5C constructs, whereas stronger COVID-19 vaccination intention was associated with younger age, more confidence, less complacency, and more collective responsibility towards the vaccine. So many community members and nurses are not ready to have a vaccination processes when it is actually available due to the, as I have just told, the reasons. The safe vaccination process and social network issues, on the other hand, these are the important dynamics to accept vaccine because people actually wanna look at how they can actually socialize and they start to, normal life, maybe we can say that. So these people are actually ready to vaccine in the general population if they want to really get in their social life again. And it suggests to actually provide more education about the benefits of vaccination to the communities as well as how they actually trusted and beneficial for their health. And the majority of care workers, on the other hand, who have worked with COVID-19 patients or had feelings of the risks have been more willing to accept COVID-19 vaccination when it's available. So individuals who are not at risk to be infected hold more vaccine hesitancy. So here is some key circumstances around actually acceptance or refusal of people's perceptions and views around the COVID-19 vaccination. As I said, many people actually felt unwillingness to vaccine, and the reasons around that, the concerns around the general vaccine issues, also they have insufficient information and trust about the vaccine, and also anti-vaccine behavior patterns or views. Some people also are ready to the vaccination because they held more concerns about actually being infected, so they wanted to take the vaccine. They might also have information about the safety of the effectiveness about the vaccine. And they also hold, some research also found that people hold inadequate information about the COVID-19 and lack of trust in authority sources. So most of the studies recommend that the urgent need for multifaceted studies around how people actually accept or refuse this COVID-19 candidate vaccine. Here is my conclusion. Many factors might impact individual vaccine hesitancy, and we really need to examine this topic. And the main issues right now in the literature tell us around vaccine hesitancy include lack of knowledge about vaccines among healthcare workers as well as the general population, and insufficient knowledge about the effectiveness and safety of the vaccine, the willingness to contact with their networks, high or low possibility of being infected, the level of trust in the public health workers, policymakers and governments, and mistrust to the vaccination programs. Actually, the last point is very important for many people based on the literature, because if people trust how policymakers as well as the healthcare authorities send a message to the public, they can trust. Either way, another way, people might be mistrust to the healthcare systems as well. Here is my really short presentation. Here is my references, and here is my research team. And thank you very much for listening to me. If you have any question, please feel free to ask me.
Thank you very much for your presentation and respecting time limitation, of course. If there are any questions or comments from the floor, now we can have some of them.
Well, actually, I have a question.
Yeah, sure.
So thank you very much. Such an interesting presentation. And we all know that COVID-19 is a very hot topic at the moment.
Yeah.
So it's really interesting. Thank you very much for sharing your research with us. I just wonder, I think a few days ago, two scientists announced that they have developed a vaccine for COVID-19, and then I think the vaccine overall has passed the third phase as well. So I just wonder what kind of reaction people are going to give. What do you think, actually? What do you think about the vaccine?
When I looked at literature, I thought that people are gonna, feel more concerns about that.
Yeah.
But at the moment, it seems very trustful vaccine. As they said, 19% or something like that. Very trustful. So right now, people probably trust and take this vaccine. I'm thinking, yeah. But it still need to examine the other multifaceted, factors around what people actually think about in Turkey as well.
We don't actually know about the long-term effects of the vaccine.
Yeah, right.
That's quite concerning at the moment. I think, for
yeah, it is not tested yet. Yeah, you are right.
Exactly. Thank you very much.
Thank you for your question.
Are there any other questions from the floor? Or any comments? Okay, thank you very much for this enriching presentation. Now we are going to move to the second presentation, and I'm